Hi, I'm Danielle Matias at Caring Medical Florida, talking to you today about big toe pain and conditions associated with it that I've seen treated with prolotherapy. Big toe specifically, although this can really apply to the foot and the other toes too, that joint is surrounded by ligaments, like every other joint in our body pretty much. So when those ligaments get stretched out, if you think about like a rubber band that's no longer tight, it's kind of floppy, that can lead to toe instability. And when people develop that, it's actually associated with quite a few different conditions. Bursitis, bone spurs, tendinitis, tendinosis, where it degenerates. So it really can be a catalyst for a lot of other conditions that are pretty common in our society. Again, ligaments, those tight rubber bands that should hold our whole joint together. When they become injured, it doesn't just only affect the ligaments that are injured, but it affects the whole joint and all the surrounding tissues. So ligament injury, excess motion. That's when you get that hypermobility or instability of the joint. Excess motion, excess pressure, right? If that joint, those bones are moving more than they should, they're going to be taking on a lot more force than they're designed for. Excessive pressure, tissue damage, right? Pretty easy to understand. So that begs the question, how do you diagnose joint instability in the big toe? Well, there's a lot of clinical signs that we say, if there's a lot of clicking, popping, grinding, popping in the joint, if it subluxes, like kind of shifts out of place and comes back in repeatedly, swelling, all of those kind of things can give us a clinical picture. But in the office, we'll actually use ultrasound to diagnose big toe instability in patients. So here is the patient's big toe with the ultrasound probe. This is at rest. So just to kind of orient you, these bright white lines here, those are bones. This is the space between those two bones when the patient is at rest. So just hanging out. When I stress the joint, like kind of when I tug on the big toe almost, you can see how much more space is between here than was here, right? It's gapped and it's moved more than it should. Now, a great way to kind of see, okay, what is the patient's normal? What is the patient's normal is compared to the other side, right? If the other side is very stable, it's not moving much, but this side has excessive motion, very easy to diagnose that that joint is unstable. Other times you'll see maybe a lot of swelling in the joint, or you'll actually see osteophytes, fancy word for bone spurs, that are growing on these bones as well, and that's actually what leads to bunions. So here, this is an example of a bunion. We're all pretty familiar with that. And what's happening on the foot is that it's actually, that toe is kind of angling in as opposed to being straight with the other toes. We did say that this was very common, right? A lot of adults have this condition, greater prevalence in women. This may be because of our choice of footwear, but other factors do play a part, and it is progressive. This means that it's not that you just wake up one day and all of a sudden this is what your foot looks like, right? It's a slow, progressive process where basically the joint instability gets worse to the point where your body starts to make more bone. This is how bone spurs develop. Your body's trying to essentially provide whatever stability it can to that area by overgrowing bone, and that's how you end up with that. Again, just to kind of reiterate the point that this is progressive, right? So there's several stages of this hallux valgus, meaning that that toe is turning inward. Starts off, maybe kind of subtle, a little bit more pronounced, and then you get into very, very significant deformities. Now, where prolotherapy comes into play. Prolotherapy is an injection technique that stimulates the repair of injured tissue. So somebody has an unstable big toe where those ligaments are loose. Prolotherapy works to get those ligaments to tighten and strengthen and restore that stability. Now, the further along, the more challenging or difficult that becomes, correct? When somebody has big toe instability, maybe a mild case of this hallux valgus, much better candidate for us trying to restore their joint. When we get very far into these deformities and that bone is just kind of stuck that way, prolotherapy can't reverse that. So it's much better to start the healing process when things are, not as chronic and have not become as advanced.